1, 2, 3, 4, 5, 6. Right. Good afternoon, everybody. Again, thank you for joining us this afternoon. Good afternoon, Senator Dillon-Remy and Senator Hislop. Thank you for joining us. Just a bit of housekeeping. We'll be starting in 3 minutes, and the format will be very simple. We thank you for being with us here today. We'll do the introductions of the committee members who are here and our colleagues from Tobago's health sector, who will give us an overview of NCDs, which is our focus today. After that, we'll just open the floor because today is about you. It's about hearing what your interfaces have been with the public healthcare system in Trinidad and Tobago. We're really focusing on NCDs, more specifically cardiological issues, cancer and diabetes, and also how you've been experiencing your access to CDAP, the Chronic Disease Assistance Program, and we'll also take some comments generally about the healthcare interfaces in the country. We're not here to answer questions on behalf of the Ministry of Health or the Tobago Regional Health Authority. We're here to hear what your experiences have been and document those so we can take it back to Parliament and create a report to get a response from the relevant authorities to try to make the system better for you. So that's the general format, and again, we thank you for being with us here today. So good afternoon and welcome, everyone. On behalf of the committee and the staff of the Parliament of the Republic of Trinidad and Tobago, I would like to welcome you all to the 5th Town Hall meeting of the Joint Select Committee on Social Services and Public Administration and Public Healthcare Services. We are very happy to be coming to you live from the Anne Mitchell Gift Auditorium of the Scarborough Library Facility in Tobago. Members of the viewing and listening audience are invited to submit their comments and questions to the Parliament social media platforms, YouTube channel ParlView, or via Facebook or Twitter. I'm the committee's chairman, Paul Richards, and I'd like to invite at this time the committee members who are here with us to introduce themselves, starting with Minister Singh.
Good evening, Chairman. Thank you very much, members of the head table. Good afternoon to all members here. I am Avinash Singh, and I'm a member of this committee. I'm happy to be here, and we do look forward to some very productive and fruitful discussion.
Thank you. Good afternoon, Chairman. Good afternoon, members of the head table, members of the viewing and listening public, members gathered here. Good afternoon, Roger Monroe, member.
And I'd like to acknowledge the other members of the committee who are Member Penelope Beckles-Robinson, Member Rohan Sinanan, Member Esmond Ford, Member Vandana Mohit, and Member David Naked. Unfortunately, they could not be with us here today. We'd also like to, on the air, acknowledge the presence of two of my colleagues in the Senate, Dr. Maria Dillon-Remy and Senator Hislop. Thank you both for being here with us today. And also our colleagues from the Tobago House of Assembly. Thank you so much. The Secretary of Health, thank you for being with us. All right? So the purpose of the town hall meeting is to focus on an inquiry into the healthcare sector in Trinidad and Tobago. It's being held to provide the public citizens and you, the taxpayers, with a platform to directly engage members of Parliament on some of the critical issues concerning the delivery of public healthcare services in the country. It's an opportunity for you to share your experiences having approached the public healthcare system, make recommendations for improving the public healthcare system, and healthcare is a broad and multifaceted area. As such, the committee has narrowed its focus to the following 3 areas. First, the combating of non-communicable diseases, including diabetes, cardiological diseases, and cancer. The effectiveness of the Chronic Disease Assistance Program, CDAP, and the standard of healthcare delivery at outpatient clinics. So we are empowered to do some things, and there are some things we are also empowered not to so do. We are not empowered to provide redress, remedy, or answers on individual complaints. However, we do have the power to hold the Ministry of Health and the regional health authorities accountable for their performance, policies, procedures, programs, and initiatives. We are one of 14 committees of Parliament appointed to scrutinize or oversee certain aspects of the work of the government. The committee's work is not dictated by any political party or any political agenda. The mandate of this committee includes investigating and reporting on all matters related to the management, activities, administration, and operations of various state bodies with a focus on education, health, gender, tourism, public administration, labor, culture, community development, and other social services. At the end of this inquiry, the committee will submit a report to the Parliament containing its findings and recommendations, which will be sent to the Ministry of Health and the RHAs for their attention and responses. We'd like to also acknowledge the following stakeholders. Before we start, permit me to acknowledge the presence of the Tobago Regional Health Authority and its staff and management and leadership, the Trinidad Tobago Association of Retired Persons, the Yahweh Foundation, the Roxbury Police Youth Club, and the Trinidad and Tobago Red Cross Society. I'm certain we have more and other organizations present, and we look forward to hearing from you all. At this time, we'd like to present an overview of today's topic. We'd like to welcome Dr. Roxanne Mitchell, the General Manager of Primary Care at the Tobago Regional Health Authority, who will be assisting the committee as a subject matter expert. I'd also like to take the opportunity to acknowledge Dr. Ogona Okeke, Medical Chief of Staff at the Scarborough General Hospital, and Mr. Garth Alexander, Chief Executive Officer of the Tobago Regional Health Authority. At this time, I'd like to invite Dr. Mitchell to make a brief presentation. Dr. Mitchell?
Thank you so much, Dr. Richards. Good afternoon, ladies and gentlemen. I have a brief statement introducing our topics today. The Tobago Regional Health Authority was established under the Regional Health Authorities Act of 1994 and is responsible for delivering healthcare services within Tobago. The mandate includes providing a comprehensive range of healthcare services, promoting health and wellness, and ensuring the efficient use of our resources. Under the 5th schedule of the THA Act, the Tobago House of Assembly is responsible for the delivery of health services within the island of Tobago. The Tobago House of Assembly grants the Division of Health, Wellness, and Social Protection the authority to oversee and implement health policies and programs on the island. And through an annual service agreement, the Division of Health, Wellness, and Social Protection and the TRHA are expected to work synergistically to enhance the health infrastructure and service delivery, again, on the island of Tobago. One of the primary focuses of this partnership is the management and prevention of non-communicable diseases. Diseases such as diabetes, hypertension, cardiovascular diseases, as well as cancers, have been found to be major public health challenges within Trinidad and Tobago, and not only on the island of Tobago. And according to recent statistics, NCDs account for a significant proportion of morbidity and mortality within our country, with up to 60% of deaths attributed to these chronic conditions. Within the public healthcare system of Tobago, the TRHA currently treats about 1 in every 8 persons for hypertension. Please note that this ratio is not a true reflection of how many persons actually are living with hypertension. It is only the number of persons we treat, and it's a ratio. In the case of diabetes, we treat about 1 in 12 persons within the public healthcare system. With regard to men and their health-seeking behavior, At most point-of-care delivery services, men make up less than 40% of the services that are delivered at our clinics, with many defaulting once they're referred in for attention. We have, however, noted that many men tend to use our Blue Room facility to access both men's health issues as well as non-communicable diseases, and this may be an opportunity for us moving forward in terms of gaining more men to come into the system. Whereas the TRHA and the Division of Health, Wellness and Social Protection work together to ensure service delivery with the main goal of reducing the burden of NCDs, there is still the need for individuals to seek health care as early as possible to reduce the development of disease complications. And as I close, it is noteworthy that together we can address the public health challenges which have been posed by non-communicable diseases, and in so doing we can improve the quality of lives of the residents of Tobago. Thank you.
Thank you very much, Dr. Mitchell. Thank you very much, Dr. Mitchell. We can give her a round of applause for that opening comment, please. So our format is going to be very simple today. We've broken up the interface into several main segments so that we can be as organized and as efficient as possible. And the segments we'll be going through include the management of the public healthcare system. Secondly, access to screening. Thirdly, access to treatment. Fourthly, health and wellness of men, because we've identified that from our previous interfaces as an issue facing the country in terms of healthcare services provision. Then we'll go through access to medication, and then patient record management, and public prevention and public awareness initiatives. So those are the main areas we'll be going through. You can come up more than one time to the microphone when we open the floor in a short while and give your experiences and your feedback and your comments on these main areas. So it's not limited to coming up and giving an experience or a testimonial once, and we'll identify you by a raise of hand. You can identify yourself by your first name or by an organization that you may be representing, and we're happy to hear from you today. So thank you again for being here with us today and of course welcoming us to Tobago. Just a bit of I was telling Dr. Mitchell before we came downstairs that I am a Tobagonian by proxy, because my mother was born and raised in Tobago, and I spent every Easter and August from about 5 years to 14 years in Speyside, which are some of the fondest memories in my life. So I hope you can adopt me back from Trinidad and welcome me back as a proxy Tobagonian, because I love Tobago very much. And of course, we'd like to once again thank and acknowledge the presence of the Secretary of Health and Deputy Chief Secretary, Faith B. Israel, and thank you for being with us today. We really appreciate you taking time to come with us today, to be with us. So we're going to start with the management of the public healthcare system. And the first question we'll pose to you is, are you satisfied with the current management of the public healthcare system in your interfaces in either Tobago or Trinidad? Because we know very often you go between both islands in some cases to access healthcare. And of course, we're here in Tobago, so we'd like to hear about your experiences in Tobago. And if you'd like to deal with this particular issue, you can show a raise of hand and go to the microphone, which will be at the center of the floor. So anyone wants to go first? Yes? Thank you.
A very good afternoon, everyone.
Good afternoon.
To members of the panel. My name is June Melville. I'm a grandmother of 2, a mother of 1, and I am a breast cancer survivor.
I think we can give a round of applause for that. We're glad that you're here with us.
Having had breast cancer almost 2 years ago, stage 1. Stage 1 because I took care of my business. I usually do medicals privately in Trinidad over the years when I worked with YTEP, and I continued even after I retired. And so, just a brief history. And so, when I had my last medical after COVID, my mammogram indicated that there was a little something which was benign. And they suggested, or the radiologist suggested, okay, do a scan, ultrasound. But my doctor, my private doctor, indicated that it was asymptomatic, so I didn't have to worry. But being an old nurse that I am, a nursing sister of yesterday, I followed up and followed up privately in Trinidad until I found out that I had just an early growth of cancer. And members of the panel, ladies and gentlemen, I know it is a very difficult situation for a lot of our women in Tobago, and I guess in Trinidad, because I have met quite a number of patients in Trinidad. I had my operation done at St. James. The doctors were absolutely excellent. I returned to Tobago, and the oncology doctor here is also excellent. But, thank God, I did not need the so-called aggressive treatment. No radio, no chemo, simply tablets. So when I read recently that maybe there are concerns with the cost of medications for whether it's diabetes, hypertension, and so on, and cancer, I was very concerned because I also received my tablets both in Trinidad, when I go to the clinics, or at the pharmacy in Tobago. Sometimes we don't have the tablets in Trinidad, and sometimes we do not have it in Tobago. And I'm very concerned about that, because we're dealing with cancer. And as you're listening, there are young persons. I'm retired. I'm almost 70 years old. But there are persons, I have relatives who are in their 30s with cancer, who have had cancer. I know persons who have recently had the operation, and they too will depend on the CDAP system. So I'm asking kindly that we consider giving more funds to the Tobago House of Assembly so that we in Tobago do not have to go to Trinidad. In fact, I was in Trinidad on Tuesday, and I asked my doctor to transfer my documents to Tobago, because going back and forth, spending a night in a hotel, that's a few $1,000s down the road. So I decided I want to have my clinic appointments right here in Tobago. So I am suggesting that we have more funds available for the Tobago House of Assembly so that they can aggressively deal with cancers in Tobago. Breast cancers are on the increase, and I believe it's going to be like 1 in 9 persons, women, our women, young women, older women, mothers, aunties, and whatever, who need that support. I also would like, when in Tobago, and I know this for a fact, when persons have mammograms, scans, CTs, and so on, the time to get the results is far too long. I remember last year, I was told that a patient was waiting on her report simply because the person who read the report was on vacation. That simply cannot be. Okay, you need your vacation, yes. But if we have to bring someone from Trinidad or train more personnel so that our patients, our ladies, should not be in fear, in distress, awaiting these very important reports so that their treatment can be decided accordingly. So we need more persons who are trained, properly trained and qualified as radiographers to read these reports. We also need a more aggressive cancer awareness program. There's so many ladies. I know of someone who told me when I reported to my church one Sabbath morning that I had cancer and I had it treated in Trinidad. Someone came up to me and said, "Sister Melville, girl, you're brave." Because she couldn't stand up and tell her friends in the church, and she was even afraid to tell her husband that she had cancer. So we need to be bold. And I'm standing here speaking to the people of Tobago, the women of Tobago, If you need support, call June Melville. I am not afraid to stand to tell you what's up, how I can help you. I've even taken a patient to Trinidad to medical associate to have biopsy and so on. We need to help. We need
Ms.
to
Melville,
help.
can I ask a question?
Yes, sir.
Is it that you chose of your own volition to go to Trinidad for treatment because it wasn't available in Tobago? Could you explain that situation to us, please?
Right. During my employment with YTEP as the regional manager of Tobago, we were allowed, or we were given the choice of having annual medicals. I chose Trinidad, near Hazley Crawford area there. And so, following my retirement, I continued having my medicals in Trinidad at the very set place where they knew me. So, having received the result that, you know, that I had a little something with regards to the radiographer's report, I decided to follow up. But I chose Trinidad because I knew then that the results would be quicker. I knew it would be quicker at Pembroke Place, you know, in Port of Spain there. You get the mammogram results the very same day. And this is what we need in Tobago, even if we don't get it the same day, but within a week, within a few days. We simply cannot wait weeks and weeks and weeks. And this is not just happening now. So it's nothing against our present administration. It's been happening for years and years, and it's far too long, and we need to stop that. We need to take better care of our women so that they can take better care of their lives. So I'm pleading, I'm asking that we do more for breast cancer. And remember too, ladies and gentlemen, men also get breast cancer. All right? And just the last, because I don't want to take too long, our ladies too must stop depending solely. Some of them depend too much on herbalists. God has given to our doctors the wisdom, the knowledge, and the understanding to treat our patients. To treat patients. I do agree that herbs can be helpful. We need to change our diet. These are things we need to tell our people. Change our diet, a more healthy lifestyle. We need to walk, we need to exercise, we need to sleep well, we need to stop worrying about the world and all the negatives in this world. Stop reading the newspapers even, and just take care of ourselves as women and be strong in the Lord. I thank you.
Thank you very much, June. Appreciate your testimony with us today. So I'm also going to throw some other questions out here for those who would want to contribute. In terms of the management of the healthcare system, what has your experience been in terms of the quality of healthcare that you've received, if you think it has been a good quality consistently, and also what would be your recommendations to improve the healthcare services in Tobago and in Trinidad if you've interfaced with both? I'm just going to ask Dr. Mitchell to give us a kind of overview in terms of what is available in terms of cancer screening and treatment in Tobago. Thank you.
All right, thank you, sir. With regard to cancer screening, we have available pap smears, breast examinations. We do PSAs for men in terms of the prostatic specific antigen, as well as we do fecal occult blood, which screens for colorectal cancers. We also have, for persons who have other types of cancers that would not be as common, we do the different cancer markers. They are available on our forms, and even if we have to outsource to verify, we do those types of screenings here on the island. We have 17 health centers, all of which do pap smears and the breast exams. For those who do not wish to visit the health centers, we have the mobile cancer screening unit, which examine both men and women, specifically as it relates to breast cancer, looking for lumps and polyps, etc. in men. We also have the Blue Room that will cater to the needs of men's health as well, again with PSAs, again with the necessary blood works for the other types of cancers. Thank you.
Thank you, Dr. Mitchell. Thank you, Dr. Mitchell. Anyone else has a comment on this particular area in terms of the quality of healthcare you received? Thank you very much. Are you able to go to the microphone? Can someone take the microphone to help for us, please? Thank you. They're bringing a microphone to you. Thank you.
Good evening. Thank you for recognizing me. Dr. Mitchell, good evening. I am Claudia Robinson David. I reside at Black Rock, Tobago. I have been a patient of the Scarborough Regional Hospital, or General Hospital, whatever it's called. And I had cause to make a report on a doctor. I will not go through further because he is now deceased. I had to challenge him because there was a little bit of, I am a doctor, you are not, and I agree with that, but this is my body. I have a very recent issue with the Tobago Regional Health Authority, well, the hospital. I have a little sister, not really a sister, but, you know, we grew up in our home. And she was recently admitted to the hospital with jaundice. When all the blood works were done, she was asked to come back to the hospital today for the results. You are in the hospital for about 2 weeks, and you are discharged, and you have to go back to get the results. So she went today, and she got the results. Well, a relative who is a retired district health visitor accompanied her. When she was told now that she has to go to Mount Hope to do a biopsy. And they were only going to, she has to go with a chaperone, you know, somebody has to accompany her. But the hospital is saying to her that they could only pay for her ticket only. Now, this young lady, she is not in any high-paying job. And having been hospitalized for 2 weeks, she has lost a lot of income. She's paying her rent and stuff like that. And I find it very strange that if the hospital was sending a nurse along with her, they were going to pay for both tickets. I recall my mother, who was not hospitalized there, and she had to go to Trinidad to do a pacemaker and then have to go back every month for a checkup, and they paid for her chaperone and herself. I find it very unbecoming that they're going to tell us they cannot pay. I know you might not be able to address it. I'm happy that Dr. Faith is here. Faith B. Israel, let me call your name correctly. And I know she would, you know, she's hearing me quite well, and Dr. Mitchell also, and some sort of redress, you know, some sort of thing could be done. One of the issues I also have is the confidentiality of patients' information at that Tobago General Hospital. I want to state a case. In 2021, I was in the United States. My husband told me that he had to go to the hospital to do a COVID test, and after he would have to do a biopsy the Friday. So he went to do the COVID test Wednesday at 1 p.m. Wednesday night, I said, you know, something is troubling me about it. Let me call him early in the morning and ask him if he had the COVID test done. I called him 8:30. He had the biopsy, he had the COVID test 1 p.m. the Wednesday. The Thursday morning, I called him at 8:30. I said, you know, I am feeling uncomfortable with you going back to that hospital. Something. He said, you know, I was about to call you. I said, what happened? He said, it was about 8 o'clock. Somebody called him. I hear you have prostate cancer. You know, it was not 12 hours when he had the COVID test done. And it was a breach of patient's confidentiality. I told him, you are not going back there. You are not going back there. Thank God we sought medical attention elsewhere, and he is in perfect health now. I have a third complaint. I am visually impaired, not by design, not by my own doing, but because of some, I don't want to use the term, but I had cause to travel to a foreign country because I realized that I was cheated and treated poorly. I had to pay a lot of money because I was attending the eye clinic at the hospital there, and your appointments are far and few between. You might get an appointment for 6 months, for sometime a year. So then the doctor said to me, well, you would have to come, I can do the surgery for you, you know, but you have to come to Trinidad. Well, you want the surgery done, you want to preserve your sight, so you did it. It was a lot of money. And I'm being told all the time, yes, the surgery was successful, you're going to see. Well, that is another story. Maybe I'll see in the world to come. So I had to travel abroad because I realized I was cheated. And you know what was pain, you know, it was very, very painful when one day I went to the clinic and I said, but you have said to me the surgery was successful and I will be able to have my vision again, but I'm not getting anything. And he examined and said, no, where's that? That's done. You can't see again. I said, just like that? Yes, you can't see again. So I traveled abroad. And I was pained when the doctor said to me, why didn't you come here earlier? We would have been able to save your sight. Your eyes were butchered. You understand what I'm saying? When you hear a statement like that coming from a medical professional, what would you think? I am saying to the Tobago House of Assembly and the government of Trinidad and Tobago, let us source competent, honest persons who can deliver proper health care. Because we are cheated left, right, and center here in Tobago. It is very appalling to know that we work so hard and pay taxes. I paid a lot of taxes, and I know all of us who are seated here would have paid taxes. And it is unfair for us because healthcare is a social problem, and we are having all sorts of healthcare issues coming up. We need competent persons who are being paid high-end salaries to deliver proper services to us so we can enjoy the life that we are supposed to live here on earth until we are called to our eternal home. Thank you.
Thank you very much for sharing your experiences with us. And of course, we're still focused on management, quality of healthcare. We're also asking the question, how confident are you in the healthcare infrastructure and services provided in Tobago and in Trinidad if you travel to Trinidad for healthcare? Anyone else would like to comment on this? Yes, please. Can you go to the microphone at the center? Are you able to? Thank you. And just so that you know, the comments are, if you've had positive experiences, we'd like you to share those also. Why everybody's snickering with us?
Good afternoon to the members of the panel and to all of you who took time to come here. First, I've been a patient in a clinic for over 15 years. And I first would like to thank the health ministry for the services. I have been able to get so many tests, blood tests twice a year I get my blood tests. And just April gone there, I was able to get a blood test. When you consider the price of these tests, I was able, by the grace of God, I was able to get 2 operations on my eyes because I'm a member of the eye clinic, and I didn't have the $12,000 or $15,000 to pay, and to a certain extent, I am satisfied with the services of let's say, members of the health service. But what is grieving me is, and I have done a research, I am a retired teacher of 41 years, and I read a lot, and I have family that doctors, nurses, and I'm always on YouTube because due to my infirmities, I keep abreast. And I am pleading for the ministry to stop giving us generic. The medicines you're giving are cheap. You're getting it from India. I know the government cannot afford. It's a vicious circle, a very vicious circle, right? This metformin cheap when you could give another one that would not have damage. I read up on the metformin and I hear there's so many side effects right now. Right now I'm suffering with my nerves because I was on the metformin for a few years and I told my doctor change it. The high blood pressure tablets too, so many of them are statin. It's affecting the other drugs that you are taking. And one is even the Simvastatin or whatever it is for the high blood cholesterol. It even they say, I don't know, I read in there, they say could even cause cancer. I know that my government, I'm not attacking, this is not politics and nothing. The government cannot afford it, and again, they drugs from India and they're taking cheap drugs. I have been in the eye clinic for the last 10 years, and I was getting some drugs. I went to the clinic 2 months ago, and I eat properly, as being pre-diabetic, to watch what I eat, and the pressure in my eye, good for years. Last time I go to change it, and they give me now some kind of prescription for over 2 years. The new drugs now, they can't afford it. This is it. And this is the problem that the government have. Our medicines that we give to our patient is like a vicious circle. It causes side effects and getting them to go back in the hospital and they're suffering from their heart and it's going wrong. If we are not treated well, we're going to suffer. We need better medicine. We need to be healthy. Look, there's one medicine, what do I say? For cholesterol, they could give ZOCOR. Instead of that medicine that is statin and affecting you. So you come to the health center, brothers and sisters, and you're taking your prescription, you're poor, you're glad for it. And these medicines are causing side effects and getting you sicker. And then you're going back in the hospital. And then we wonder what is going on with our health service. The Chinese man said, cheap thing not good and good thing not cheap. Something has to be done and stop with this generic medicine that we are getting. Right now, I am buying, even though when I go to my doctor in the clinic and they give me some things, I go outside and I buy it. When I go to the pharmacist, they say, what the health center giving you is generic, and I have to pay more for it. Right? Right now, members of the panel, we in Trinidad and Tobago can't afford to get sick. If we get sicker, and we go in the hospital, and our blood start to clot, they don't have the medicine for that. You know what some of them doctors are asking for? They're asking for samples. They're asking for samples from the people who bring drugs. And then again, what is going on is the whole system. When the hospital needs drugs, they have to send it for the ministry, health ministry to approve. When the ministry approve it now, then they have to send it to the warehouse, the nip deck, and then they have to package it, and then they have to send it back to the hospital. These poor doctors can't get the medicine. Some people, when they have an operation, they're asking them to walk with the medicine. Go and buy your medicine. So if we don't do something, it's a vicious circle. We can't get better. And then what I am fearful of, after paying my NIS, teaching for 41 years, and I now looking and hearing that something that I might have to pay for generic medicine. Oh, God help me. I had to go now and go and face the pharmacists and the medicines more expensive. We need better medicine. We need to improve and let the ministry it be more sustainable. We need a faster flow of the drugs to the hospital, that when we are in need and we're sick, we could get it. I am not complaining about the government because I am so glad. I retired 15 years ago and I'm on a salary, a pension 15 years ago. The cost of living gone up sky high, and every minute this more and this more and this I have to pay. How could I go and pay now for my medicine? I am pleading that something should be done. No, we had the 3 topics. The one there was the effectiveness of the CDAP program. I did a little research on it. I don't know which one of the government, whether it's PNM or whether it's UNC, I don't care. I don't know which one of them. When they introduced the program, they were just giving retirees. By the way, I am a TAP member of the Choral Assembly of Tobago. So I am representing TAP. I don't know if they would be pleased with what I say, but you say talk about experience, I'm telling you my experience. You understand? We on retirees on pension that is 15. I wonder about those who 20 years ago, what they getting. And then I hear about telco or something on some $900 a month. Tell me how these people could survive.
Okay, can I interject? Sorry to interrupt you,
Yes.
but we're not talking about pensions or
I know we're
NIS,
talking about
right? So
getting medicine.
Right.
We're talking about getting medicine. If I don't have money, how could I get my medicine? Now you talk about the CDAP program. What could be done? Government had to have belly. You know what government had to do? Instead of giving everybody, cut it off. Get the pensioners, get the old people, and get the real poor. Not everybody. You cannot afford to give everybody. Everybody looking for free medicine now. Cut it out, and then you would have more money. And as I close, the recommendations I would give is, and you could carry it to the government. While we, retirees, pensioners, poor people, while we are suffering, cut down on some of the perks, cut down on some of those, let them pay for their insurance, whatever it is, for their cars. And then we'll have more money. We have a financial problem. It is a fact that they don't have the money. But do something, recommendation, and the health service would be able to be better. Put more money into it. Thank you very much.
Thank you very much. Is there anyone before we go to our next topic? Yes, sir. Thank you. And then the gentleman in the striped sheet, and we move to our next topic after that. Can we try to keep it a little concise so we can accommodate more comments, please?
Yeah, thank you. Good evening, everyone. Good evening to the Parliamentary Committee members. Name is Jerry McFarlane, and I could say I'm a former member of the Tobago House of Assembly. I could say I'm a former member of the TRHA board. I could say I'm a former member of livestock farmer. But today, I want to be here as a citizen concerned about healthcare and development on this island. And I just want to keep in line because you could easily get carried away by some of the issues that has been here. The issue of NCDs is so serious on this island. And the medical doctor indicated that the deaths by this thing is about 60%. I'm convinced to my bone that the deaths from NCDs here in Tobago is much more than 60%. Much more. Maybe those are what the records maybe that you are having or averaging from who come to the clinic at the hospital or who are hospitalized. But based on what I'm seeing, what I'm hearing, and some of the results I'm getting, it's that it's much more, and it's a serious thing to do. First, we have the issue of cancer, where I don't know if sufficient research is being done to determine what is really causing this thing. I know that people associated this thing with sweetness. Everything you buy now had to be either sweet or salt. Else it ain't meet in the market and the people are picking it up. Where is the outreach to tell people that, oh God, these things are sweet and they're not doing you any good? Try and avoid that. What about parents reaching out more to our parents and telling them about the little children who just depend on something sweet? What about the necessary research on the food that we import or even we get locally? We see things like cauliflower looking clean and smooth, bananas looking spotless. How you think they're looking like that? You think they just wash them with water? The chemical they use to preserve them and to make them spotless. I've seen it for myself in some of the islands in Puerto Rico, in Dominica, St. Lucia. Former Prime Minister John Compton took me and showed me what they do to these bananas to have them shipped out and to stay looking good and spotless. Are we not going into looking at some of these things? Where is the food and drug unit of this country to determine the quality of some of these goods and things that we import to eat in particular? Is that unit functioning? For more than years now, we hear that they're not equipped, or they don't do anything, or they're not operational. Something must be done. And as parliamentarians are here today, I'm saying, making a strong recommendation that as parliamentarians, as was done, I think, in Mexico some years ago, they mandated that some of these soft drinks and these sweeteners and so on should be of a certain percentage, or you could be charged and fined. We have to get serious with our manufacturers. You've given them the opportunity to kill us. And many of them maybe sometime come and have to sponsor the political environment. But talk to them seriously about too sweet is not too good for the population. A very serious thing. We could start there. And as parliamentarians, as chairman yourself, I'm sure you could pilot some bill or some motion to mandate that people or manufacturers in this country, importers of food items, have their ingredients checked or the contents of some adverse drugs or preparation that they use in these things to be monitored and to be regulated. One solid recommendation. With respect to the NCDs as well, there's an issue that has been going around that I've been discussing with many people for quite some time now. In 1948, before even Wassa was conceived, there was a line running from the Hillsborough Dam into Mason Hall, coming down from the hills to the dam into Mason Hall. That line was put in there since 1948, I'm told. That is an asbestos line, asbestos and concrete line. And over the years, we've been wondering, what is causing this increase in cancers, even before these modern times? People are ashamed to talk about it, and so on. And many people are concerned about this line, 12-inch line, from Hillsborough Dam, going straight into Mount St. George, coming down the hill, going into, not Mount St. George, Mason Hall, into Mason Hall. That is something we must pay some attention to. That line was lined with asbestos. I mean, we can't blame people now for that. And maybe after almost 80 years, you don't know how effective that thing, if it was poisonous. But we know more than 40 years ago, they banned asbestos from almost every possible place in this country. And outside, in the outside world as well. So we must investigate how potent this asbestos line is after 80 years, or if it is quite all right to leave it like that, and who dead, done dead already. But we have to investigate and to ensure that some of these lines that we're using, or even some of the containers that we are using today, don't carry some carcinogenous, cancerous material, or if it's heated, or if bottled water is exposed to sunlight at a certain temperature, what is going to happen? The public and the people who train, the public health professionals and so on, and the other experts must be informing and telling the people about the dangers of these things. And that again is where food and drug comes in. It's not a private sector entity, you know, a government entity called Food and Drugs Division. What are they doing to check on these things? To determine how sweet is sweet, how salt must be salt, how salt things are. What is the acceptable level of sweetness? I checked some things the other day. I go to the supermarket. They put in sugar even in bread to make it taste good. I mean, something have to be wrong with our people and the way people guide us or guide the population through these things. And I want to come to my final point here, which to me is one of the more important. I call it the paradox of healthcare service in Tobago. We have a hospital in Roxborough recently established. After a lot of political toing and froing, after a lot of time, I don't want to say time wasting, it took a lot of time to get the place functional. And the work at the hospital, Roxborough Hospital, today, as with its limitations, is second to none in the region. The work and the service at Roxborough Hospital, you quote me on that, Chairman. Quote me on that. The service provided at Roxborough Hospital today is second to none in the Caribbean. That brings me to my point, the paradox of the healthcare system in Tobago. You know, in spite of that service, people leave it. I talked to a lady today. She living just behind the Scarborough Hospital. Finds herself in Roxborough today to have an issue dealt with. That she going around for years, that these people at Scarborough Hospital pushing around. Up to 4 weeks ago, a woman had some, what do you call that, belly pains and belly issues, you know, fibroids, serious fibroids, plenty fibroids. Scarborough Hospital has been putting that woman going to clinic for 2 years. 2 years. The woman went to Roxborough. They take out all the fibroids that giving her problem, inside and outside. 2.5 hour operation. Successfully done. I don't know if they want me to talk about it, but I must explain to you, sir, and your team, that all this thing is happening in Roxborough and more. There's a doctor called Dr. Otley, one of the finest vascular surgeons you could find in this country, working abroad, coming here to Roxborough Hospital, giving free of his services and his competence. At Roxborough Hospital, people who couldn't get surgery done for years in Scarborough got it done up there for a short period of time. The paradox I want to talk about is that the board, TRHA board, apparently jealous or have some particular reason of something. Tell the chief medical officer at Roxborough.
Here what I want you to do. I want you to stick to what we're focusing on today.
Yes, I just want to tell you, we're talking about healthcare.
What you are doing is bringing up stuff that I can't independently verify.
I am telling you about my experience and what many of you experience. You hear people clap here today.
So we're talking about the healthcare services.
I'm talking about the healthcare delivery. You said that is one of the things you want to talk about.
But you brought up a board member and you're suggesting things that I can't.
I'm saying, all right, the board of the TRHA has indicated to the people at Roxborough that they must not do any surgery. That is what happened recently. No surgery is now done at Roxborough, instructed by the board. So an attorney at law who happened to be chairman is now telling a person who studied medicine not to do any medicine, but you have to apply to her to get permission to do surgery in Roxborough. You can imagine that? Right, I'm talking about healthcare in Tobago, you know. I'm personalizing it, you know. Right, I'm talking about healthcare on the island.
Let me just interject. I appreciate your comment about it, and it has been noted.
Very well. And I hope serious attention will be paid, putting people in positions of competence, and that persons may be had too many pies, and maybe that went to the head. Thank you very much.
Thank you, sir. I'm going to let my colleague, Member Monroe, ask the focus, introduce the next topic, and then we take the gentleman in the stripe who can comment on previous topics and the topic that Member Monroe is about to introduce. So the gentleman in the stripe, and then we take the gentleman in the blue jacket. Thank you. Member Monroe.
Thank you very much, Chairman, and good evening again. I will touch on the topic of access to screening. I would like to know from anyone who is here, have you ever encountered challenges with accessing medical screening at a public health institution? If so, please share your experience. And also, I would also put this one on the record one time. What has been your experience with accessing specialist medical care in Tobago? Have you encountered any situation where your specialized doctor could not be accessed because of a shortage of that personnel?
So the floor is open with the gentleman in the stripe, and you can comment on the previous issue also, and include the issue that Member Monroe has now introduced.
Yes. Good evening, everyone. Now, my name is Roll Anderson, and I am the Secretary of TTAP Tobago Corals. Now, from time to time, we meet in meetings and we bring up issues pertaining to health as it relates to elders. And we have had a very serious one recently. I don't know how effective this will go in your dealing with the issue. We spoke about the fact that elders have to have medical to access renewal of driving permits. So we are wondering if that facility could not be given to elders at our health centers, where the doctors at the health centers can issue those medical certificates to the elders so that we can access renewal of driver's permits.
So is it that you have to go privately to get it? It's not available in the public healthcare sector?
Yes, we
Okay.
have to do it privately and pay privately too.
So you wanted, one of your recommendation is that it be available in the public healthcare sector?
Yes, that's my
Okay.
recommendation.
Okay.
Right. I had a personal issue, and you could tie it with the second issue that we're dealing with, and that is screening. Now, I had to attend the health center, and I did certain tests, and it was found that I had low blood. So they treated me for the situation, but it never improved. So the doctor said to me, I don't want to scare you, but we want you to do a colonoscopy to see if there is some cancerous situation that is taking place. Well, that is where my trouble started. Now, I was referred to the General Hospital at Scarborough. I saw the doctors there. The doctor recommended that I do. Now, the doctors might be able to tell me the tests. I can't remember the name, the medical name, right? But it's some test that you have to do, some anal something, that they put something up your rectum and, okay? And they get some pictures of something. And I've been going to the hospital every single month, only to be told, go and get a next appointment.
How long has this been going on?
About 6 months.
For a situation that may be potentially cancerous?
Yes, So the last doctor I saw was a female, and she prolonged the thing. She said, okay, since they cannot get the whatever is to be done at the imaging unit, come back in 2 months. I went back in 2 months. You know, she insisted that the person who's taking the information, that they do this test because it is necessary, it is needed. But I stopped going. Because I can't leave home, spend almost a whole day in the hospital to be told, come back next month. Because I can only go back when they have called me at the imaging unit, done the test, and the doctors will now determine what it is.
So let me just...
I am saying...
So for clarity, so when you go back, it's not for the test, it's for an appointment.
Just to see the doctor to tell me come back next month.
So is it that when you went, so you've gone for several months,
yes,
what I'm hearing, and at no point during that time have you actually gotten the test?
No.
So what are they telling you? Why are they telling you you didn't get the test?
Well, the last thing I was told is that the doctor who's supposed to say when this test can be done is on leave.
For 6 months?
No, he was on a 2-week leave, right? Maybe that 2 week has been stretched to whatever, I don't know. And I am saying that this is unfair to me. So you know what is my most recent thing? I have lived my biblical allotment already, and I'm living on lining up. Okay?
So is it that because of the inability, for whatever reason, to get the test after going several times, month after month, that you decided you're no longer pursuing that?
Not that I'm not pursuing it, but the people at the imaging center, they have not called me up to a little while. And it's only when they have called, okay, that I would go to do the test, and then I will go to see the doctor for they to tell me whether it is cancerous, yes or no. If it's a cancerous situation, I'm seeing down the road. That's my personal experience. I stopped going. I can't waste that kind of time.
Well, I hear you, but I want to encourage you in the interest of your health to reconsider that position.
Reconsider what? Because what I'm saying, every time I go to see the doctor is just to be told, go and let them give you an appointment for next month. Because the test is not yet done, and they cannot do anything until the test is done, and the information is given to them so they can determine. I am willing to do it, I am willing, more than willing to do it. But I'm saying this is just my experience.
I understand. I'm sorry that you have that experience. Is there something else you'd like to share with us?
Yes. As secretary of the group, the zone, we call it the zone, I have had the opportunity at one time to write the TRHA board for a meeting by which we can discuss issues that we think elders want to have dealt with. The only thing they did to us was to acknowledge receipt of the letter. We made several attempts to get the meet, and that never happened. So you know what happens is that sometimes because we old and we give up. Like, they don't care about old people anymore. You understand? They don't care. To me, it's that they don't care about older people anymore. We are old and we are just waiting to die.
That's a really sad sentiment, and it's really unfortunate to hear that, because I think anyone at any age level has the equal value for their life, and I hope that sentiment can be reversed by what we're doing and the recommendations that will come out of this interface.
No, I just want it to sound bad. I want it to sound bad. You understand? It's not that this is what I am expecting in life, I am saying it to make it sound badly so that the people who are here, if they are here, that they can hear me and they can... And you are, Mr. Chairperson of this group, I think your duty is to hear us and to make whatever recommendations. So I want it to sound as badly as possible to you, so that when you're making your recommendation, right? You can help us. Because, I mean, if I, listen, you see the thing about the NCDs, I don't know about, if you know what, we are suffering badly in Tobago, and we need to do something, some lifestyle change, whatever, to correct that situation. I'm glad Mr. McFarlane made the point about the Roxborough Hospital. Well, I'm from Roxborough. That's enough. Thank you.
Thank you so much. The gentleman in the blue jacket, and then the lady over there, and then the lady in the back. And the reason why I'm responding is because it actually pains me to hear people sound like they're giving up and they're losing hope. And that's very painful for me to process. So you can go ahead.
Good afternoon, Mr. Chairman and members of the panel, and everyone here, good afternoon. My name is Max James. Like my colleague here, I was also a member of the Tobago Regional Health Authority, also a member of the Tobago House Assembly Secretary in my time, 1996 to 2001. Like him, I'm now a member of the public. I'm particularly concerned about health care. As you may know, some of us, we fall ill and we are subject to the vagaries of the service and the society and the things we eat in general. My professional studies, Mr. Chairman, have prepared me to speak about competencies. As you said, congratulations on your attainment of your doctorate. I've followed you closely. Now, so that I always used to tell the members of the TRHA that I am not paying you to be incompetent. I pay you to be competent. And I think that competencies, once we can't arrive at them, cause a degeneration of the healthcare system here in Tobago and anywhere else, and in every walk of life. I remember when I was on the board of the TRHA, that a woman died because of, I believe, to be gross incompetence of 3 particular persons. I won't call their names today. And you know, when people, doctors in particular, are incompetent or they just don't care, as someone said, my friend Claudia Robinson, we're in the union together. Claudia, I'm sorry to hear of your demise. And then you know, well, not demise of I beg your pardon, unfortunate circumstances. Again, doctoral or doctor incompetence. And you know, at the end of it all, they want to get away. They can do what they want, and you can't talk about it. So that it is something that your committee must deal with, because it could be your father, if he's still alive, your mother, your brothers or sisters, or your children. It cannot be that we could continue to prosecute a system where incompetence put our health care in jeopardy. It is something that the committee has to pay attention to.
So let me ask you a question based on that, because very often, in not only the medical sector, but in any sector, yes, there may be people who are incompetent, but the system also should have mechanisms to identify those persons who may not be performing optimally or adequately, and either remediate or remove. So is it only the competence of persons, or is it also systemic in some ways?
It is systemic in many ways, not in some ways, in many ways. I'll extend it to that. And it carries us to the juncture of policy making. I have a thing or two to see on that, because policy, as you would realize, goes to the root of anything. What the policies that push our healthcare, that our healthcare stand on. And so this woman died, and then recently, in Roxborough, another woman died, and then her baby died as well. And as I have said publicly, because I tend to speak very fearlessly, it has nothing to do with my party or your party. I'm a citizen. I'm from the country. I'm from Belgarden. My whole family. We're from Belgarden. Much of us have gone on through education and opportunities, but I'm still there. I went back home to see my mother until she died. And Mr. Chairman, it hurts my heart when I hear of these stories where a woman can come into and she's pregnant and she can die in the system. And when I asked a particular doctor, had that person come to you? And he told me, I don't know what would have happened, but I could tell you I never lost one. And that brings us to the whole question of policy. Because I myself heard of that story where the board of directors prevented the policy, we're talking policy, at Roxborough is not to do special serious surgeries that were done before. And they intervened based on policy to say stop it. I remember when I was in the assembly, I myself sat and approved the scholarship for Dr. Anroy Utley. He's a trauma surgeon, he's a vascular surgeon, he's a robotic surgeon, general surgeon. And here he's coming back after all these years to give this service, and he's debarred. That cannot issue. I was very elated, sir, when you said that the TRHAs, or the TRHA, or all RHAs, must be held accountable to your committee. And then the TRHA put out a communique, what I termed as very egregious, where they say, or they said, that they did their own investigations and the investigation is complete. It's so appalling, it's so wicked, it's madness, I don't know how to do it, I'm lost for words.
Okay.
And so I would like you, sir,
Right.
since you have said here today that RHAs must account to your committee because they can't hold an investigation into the deaths and then conclude on their own to say, we are concluded, everything is okay, and that's the end of the matter. 2 persons have died. And I'm saying, maybe debarring, maybe a few here, some of them are here, they must not be allowed to get away with that.
All right. What I'm going to do, give me a second.
All right. Yes, sir.
I think you've made your point, and we knew this would come up, and you want some level of accountability where that is concerned, right? I
Yes.
don't want us to go further to include
fine.
anyone's character or reputation.
No, I'm not
because
gonna
I don't want to get to that stage.
No, we're going to
okay?
get to that.
All right. So
I just want to say.
So I note
that-
your point, and you are concerned about it, and we have taken note of it.
Right.
Thank you.
And just for my ears, and that's based on your terms of reference. It should not be, Doctor, where people are allowed. I'm not going to any character assassination. I'm not going to do
What it
that.
sounds like to me
No,
is
I'm
that
not,
right. So
I'm not going to do that.
Right.
I'm not going to do that.
I
But
want
I'm
you to
saying,
be very careful.
yes, I'm going to walk a thin line. I'm saying accountability should be held where the public has to access healthcare. We must not be afraid to enter our healthcare system and then you hold an investigation and say all is well. Now, as it stands, because I want this for the record, if a pregnant woman is coming from Charlottesville, Roxborough is on the way. Based on that policy, they have to bypass Roxborough and they find themselves an hour drive, or 1.5 drive into Scarborough. Somebody can die again. And that is what I want to bring out in this meeting.
Much appreciated. So you'd like a reconsideration of that policy?
Exactly, and they shouldn't take too long.
Thank you.
Right.
Thank you.
Final point is, I myself had heart disease, and I would have used medicines such as Vastarel and Procolaran and Plavix. And those synthetic medicines are very dangerous. Many times when I alighted out of my vehicle and reaching home, I would see stars, my head would spin. And I had to stop using them and use natural enzymes to get rid of the congestion in the vascular system. So that I too am very concerned about the performance of certain kinds of drugs. We must, if you would want to recommend that we find alternative drugs or the treatment of those things, because I can tell you my experience is that when you, I mean, they're powerful drugs, they work, but you have significant side effects. I'm telling you, you feel as if you're falling down and you're seeing the stars, the electricity, and so forth. It's really dangerous. And that has been going on 12 years now since I'm free of that, because those enzymes, that natural enzymes I'm talking about, they really do clear the blockages in your vascular system or your arterial system, whichever you want to say it. The other drug is metformin. I used to use it, and I'm telling you what, it's very dangerous. The need to find something. I mean, because I'm an avid researcher, and also, so therefore I use alternative things, and it's absolutely under control. That drug should be banned. It's very dangerous to people who are pre-diabetic and diabetics. Thank you. Good evening.
Thank you very much for your intervention. The lady in the black, and then the lady in the white in the back. If you stand together, you can represent the national flag.
Good afternoon, everyone. My name is Joyce Phillips Benoit. First of all, let me say I have been in the health system for a number of years, because pre-diabetic and even before I had my 2 eyes done with cataract in 2013, one in March, one in July, and I'm seeing very well. So I have some good recommendations for the CDAP problem. However, recently I was taken off of metformin. I am buying my own medication now. The Geneva is almost $500 per month, but I am prepared to buy it because, fortunately for me, from the time I started working, I maintain medical insurance. So I am prepared to buy it, and I'm seeing the results. As a matter of fact, I was at the health center on Monday, and the doctor was so pleased because I saw her in, now it's what, because I haven't a bit of memory, so just in January I saw her, and when she saw my report, because I usually take, and she said, wow, she said, Miss Benoit. And I said to her, what? And she said, you are doing so well with your things. So she has cut down on a lot of my medications, and I'm doing well. And apart from that, my diet, I watch my diet and stuff like that. But my main reason for being here is that I had a problem in August last year, and I went to the walk-in clinic. I was sent for an ultrasound. I don't want to go into too much details of what it was all about. I was sent for an ultrasound. I got the report of the ultrasound, and I was sent for a further scan. I did that scan since in November, on the 16th of November. I'm still waiting. I'm still waiting for up to Tuesday. I checked for the report, and it's still not ready.
So they're telling you it's not ready?
All they're saying it's not ready. In March, in April, the doctor gave me a letter to get the film, because she made an arrangement with a doctor at Sandy Grande to have it read, preventing me from having to pay for it. And they told me to come back the next day. I took the thing on the Thursday. They told me to come back on the Friday for it. I didn't go on the Friday. I said, how they operate. I decided to call the Monday to see if it was ready. When I called the Monday, they said to me, you have to bring something from the doctor. I said, but I brought something from the doctor, right? Anyhow, it's not ready. It's not ready.
And where was this done?
Pardon me?
Where was this done?
At Scarborough.
Okay.
And I saw a gentleman, and he was very, very rude to me. Very rude, right? It's a good thing I changed now, or else.
Praise the God.
Because I was at hospital again on Tuesday, and believe you, I went with my speech for him. Had I met him on Tuesday, he would have got it full blast from me. But luckily, I met someone else.
And the young lady was very nice, and she said, Miss Benoit, it's still not ready. So that is what I'm thinking, because what they said they saw something and they sent me for a further thing. And I'm really concerned. All I want is just to get I'm prepared to pay to get it read. Just give me the film. Just give me the film. That is all I want. That's all I have to say this afternoon. I don't want to go into too much of my
Thank you.
personal details.
The lady in the white, and then the lady with her hand up there, please. And then the lady in the blue. Thank God you changed, huh?
Good evening, everyone.
Good evening.
Parliament and the citizens of Tobago. My name is Pam Delancey. I am a U.S. citizen. My father-in-law was in Scarborough Hospital about 3 years ago, and he passed away from emergency surgery. Just before I continue, I am a retired U.S. Army nurse. I was in the U.S. Army for over 35 years as an Army nurse. So I have seen and have experienced the healthcare system here in Tobago. And my father-in-law did pass. But one of the things I noticed when, before we could get here and check on him, he was discharged from emergency surgery within 2 days, but he was not sent home with any type of heparin injections. So he ended up dying from a blood clot, which could have been prevented. He should not have had to die that way, and he did. But it's not all, death is death. We can't stop it. It's going to happen. But I think that could have been prevented had he been properly treated after surgery, especially an elder gentleman over the age of 85. Anyone over that age should be getting heparin injections after surgery to avoid blood clots, because we know it's going to happen. Secondly, I would have to say, though, I have experienced the health care personally myself here in Tobago. I injured my leg. I cut my leg very bad. I had to go up to Scarborough Hospital to the emergency room, end up getting 8 stitches, and it was very successful. The ER doctor up there took great care of me. I have the scar on my leg right now, but it's totally healed. I didn't have any problems with it. I would just have to say, as a foreigner, though, coming to Tobago, I appreciate the free health care. But I think as foreigners, there has to be some type of checks and balances in place that when we come in and we do have to get emergency care, that we should pay something. I think we should leave some kind of money. I don't think you guys don't realize how blessed you are to get free health care. They gave me free bandages, and they told me to go back to the health care clinic for follow-up, and I'm thinking, you got to be kidding me. And there was no charge. So I think as a foreigner coming in, if we do have to go to the emergency room, I don't think it's unreasonable to ask us to pay for something toward that care. The other thing I wanted to say, for the gentleman that has been going back and forth to the doctor, I would just highly recommend that if he has not had his colonoscopy, that someone from this parliament interject on his behalf to make sure he gets that, because if he does have cancer, it's going to be too late by the time they find out if he has been delayed this much. Myself just recovered from cancer in the United States, but I was treated quickly. I had my 6 months of chemotherapy. I'm recovered. And so I would have to say, if you wait too long, it's going to be too late. And he will pass from that, and there's no going back. The other thing just from the things that I've been listening and hearing, I hear a lot of people saying that they do not like metformin, but metformin is used very widely in the United States for diabetes, and it's still being used along with glyphosate and otherwise go on insulin. So, you just have to look at every medication you take, there are going to be side effects. And some of those side effects can be very bad according to you as an individual. So if it's bothering you, you need to talk to your doctor about tailoring back. But other than that, we still use that medication. And I would just like to say thank you for your time, and thank you for all the citizens for allowing me to have this opportunity to come and speak.
Thank you for your service, and thank you for sharing. I'm just going to allow Member Singh to introduce the next topic, and then go to the lady with her hand up, and then the lady in blue, and then the other lady. So Member Singh. And you can comment on any of the topics we've done so far, in addition to the topic Member Singh is about to introduce.
Thank you very much, Mr. Chairman, and thank you to all of you all who have really very passionately give us some experiences that you all have here in Tobago. Particularly, I really want to, just before I go into the next topic, I want to comment on the last speaker, because I was just whispering to MP Monroe some of the experiences our relatives would have when they go, go abroad. The first thing you are approached with if you go to a foreign hospital is insurance or pay. Whether you go for emergency, whether you go for treatment, that is going to be the first question. So, as challenging, sometimes we might say, I think Trinidad and Tobago, we are still very much in a blessed situation. And we must be grateful for, at least our citizens and visitors being able to be afforded, I would say reasonably good health care. Because I am particularly a believer of the public health care. And, sometimes we take it for granted. But when you travel, you really get to see the blessings you have right here in Trinidad and Tobago. And Mr. Chairman, we really experienced that during the heat and the height of the COVID pandemic. When I was speaking to my relatives away, and we were doing some comparison as to what we were being exposed to here in Trinidad and Tobago, as opposed to what some of they were being exposed to in first world countries. I think we were very blessed to have, some of the experts in Trinidad and Tobago, affording us the care that we got. So the next topic, much of you would have made reference to it, and it's really to do with access to treatment. Now, in listening to some of you, I know we spent some time in cancer treatment. Have you had challenges accessing treatment for diabetes and hypertension also? And if so, please tell us about these challenges you've been experiencing. And while I'm at that, and something for you all to think about, and this is a question I asked and I posed at the last session we had in Trinidad. Have any of you all been exposed to the public healthcare sector here in Tobago where someone from the system tells you, hey, well, the machine is not working or you can't get it done here, and then gives you their business card, or then say, well, down the road, come and see me, and indirectly tell you, come and get it done privately. I just want to have a comparison in terms of if some of you all approach the public healthcare facility in Tobago and be afforded a response such as that. And I want to say that in some of these cases, we realize sometimes the machines may very well be working, but of course it's convenient to say it's not working because, as a patient, you would spend your last dollar to feel better. So I'm just going to put that out, and of course, you can ask any question or give us any response or experience around this topic, Mr. Chairman. Access to treatment as it relates to diabetes, cancer, hypertension, and of course the other one that I threw out.
The lady with her hand up, you can go ahead. Thank you, Mr. Singh.
Pleasant good evening to everyone.
Good evening.
My name is Rosemary Degan. I'm a proud Jamaican. Now, I will start by congratulating my treatment at the Roxborough Hospital. It was excellent. I got ill over the weekend, a particular weekend, and I didn't know that it was open for overnight. And I was like worried that I'm still ill. The time is coming where doctors and nurses need to go home. And they were so patient. I had to stay because of my condition. I had excellent service right during the night. The next day, I was feeling a little better and I was sent home. And I must say, I really and truly appreciated the level of service. Their customer service was excellent. And I will definitely think that Roxborough Hospital should be looked as an example as what is it that we can offer to other. When I say we, because I've been here a long time, and so I consider myself a Tobagonian. Now, my recommendation is that I had an issue with wax built up. No, I'm a teacher. I need to be hearing. And I would say to my students, you have to speak up because Miss not hearing you. I've been to the hospital maybe 4 or 5 times, and it's still an issue. What I realize is that they lack the instrument. I was told on the last occasion that there is a doctor from Trinidad that comes over once a month, and I could see that doctor. No, it's not a case of, to me, it's not a case that they had the equipment to deal with my issue. It was that they have tried and it was unsuccessful. The little thing that they had wasn't going to cut it. So maybe we could have a local ENT doctor at the Roxborough and also the equipment. Now, there is the issue of elderly in the community. The hospital is a little distant away from the main road. Now, we have been suffering in Tobago from what we would call it infrequent, unreliable public service. Now, the elderly, they're waiting on the bus because they don't have to pay. Now, it is no guarantee that it will arrive. We have 3 in the morning, supposedly, but sometimes you might get 1 or you don't get any, or you might get 3. It's a game of chance. So if they have an appointment and have to wait on the bus service, that is a sticky situation. In addition, there is no shuttle. I would recommend that there's a bus shuttle to take patients from the main road to the hospital. I have never traveled anywhere and seen so many amputees and since coming to Tobago. And I'm wondering, are they getting paid to cut these limbs? Why is it so frequent? Because I'm coming from Jamaica and we like our starch, we like our sugar, we like everything that Tobagonians like, but we don't have that amount of amputation relating to diabetes. My father died from diabetes. My sister is diabetic. I have to be careful. No, but I just don't understand why it's reached to the stage where they have to be losing a limb. So I think that we need to look at early childhood. Our curriculum needs to address nutrition. In addition, we need to have active school nurses. Do not wait until the problem occurs. Let us look at the preventative side of it. There is so many entities that is in Tobago that could work with the health system. We have the churches, we have the police youth clubs, there are so many clubs. Come together to deal with the elderlies. You have persons who are getting treatment, they have maybe 12, say 6 or 12 medication. We don't have much travel nurses to help them how to take their medication, how to really eat. So even though they're getting assistance from the hospitals and the clinics, when they go home, they're making mistakes in taking their medication. So I would believe that we need to have more travel nurses. Now, when it comes to healthcare literacy, we're in the age of technology. I think that there needs to be in place telehealth. Telehealth is basically utilizing the social system, whereby you might have video conferencing, you might have it on the radio, you might have it on the telephone. Utilize these things. We have town council, village councils. When we have village council meeting, we could interject in how to take care of oneself, how to take care of our medical issues. Interact everyone. Don't let it be only one sector just doing it, because we have seen that it is not reaching the entire population in a timely manner. Another thing is that I believe access to healthcare is important to overall physical and social and mental health issues and the quality of life. Avoiding preventable deaths and expanding life expectancy is important. My issue that I have come to realize that because we are small, that privacy is not paramount. I think that there should be laws, especially for nurses, not only for doctors, when they breach privacy, because since coming here, I have been told do not get involved with the males because they have HIV. I have gone to clinics and I'm hearing the nurses talking and I can tell you who have HIV. I think that if I come and I have a disease, it's my story to tell, not your story to tell. So I don't believe that persons who are in the medical field, unless it is to prevent the continuation or, of that disease, then you can have some leeway. And I think the law will permit it to an extent, but not so freely whereby your medical records are being exposed and being discussed. Too much of people's private information is shared without their consent. And that needs to stop, especially in the health center.
When you say shared
Share
in
among themselves the conversation, because it is, the health center is so small. I can hear the conversation.
X knows Y and Y knows Z.
Right.
And Z
I am
knows A.
hearing the conversation being discussed, not by the doctors, because the doctor's office is a little bit off, but many times the nurses are there, and you have cleaners privy to the information because they're moving up and down, and they're having the running discourse, and it should not be so.
And before you get home, your information is waiting for you.
And not for you. It's a town council meeting with everybody else. So another thing I do believe is that we need to have nurses who are medically trained in certain areas. I think persons just want to be a registered nurse, but what about the mental health issues? Mental health is something that is becoming a buzzword in the Caribbean, but I don't think we are addressing it with that importance or urgency. We have persons, I have someone in my village that is bipolar, and we don't really understand what it is, and persons might abuse that person when they're having a manic depression or they're having their episode. We need more literacy on mental health. As I stated before, we need the travel nurse, we need the mental health nurse, we need the management, I think managed health nurse, because there's, I think, about 31 types of nursing. So I think if we come and find the monies to encourage persons to go into these fields, maybe offer scholarships to persons who are undergoing their training, that they could go into this field that can benefit in the long run, because mental health, everyone is exposed to it. It doesn't matter if you're rich, you're poor, you're young, you're old, or you're educated or uneducated, your health comes into play. So I would definitely ask the panel to look into how we can address having these specialized nurses, because health service without the nurses is going to be very, very hard to spread the word and to treat people in the way that they should be treated. Now, I don't know if we can have buses or healthcare vans that go into the rural area, because I'm from the windward section, and a lot of persons would find it difficult to access the clinic and to come regular. So you're saying
access to
health
treatment
care
should include transportation for the treatment?
The shuttle service also, but I'm talking about even having persons coming to visit. I have friends who will literally tell me, Rosemary, we make a lot of money traveling. I will go out and I will educate persons. I specialize in diabetes, another one specializing in counseling, and they will go out into the field. So I'm saying sometimes we have to bring the healthcare system to our target audience, and I believe the target audience in this state is that the elderly are not really being addressed. So we need to have some way of addressing the issues, and one of the recommendations is by having a mobile service whereby nurses are there to go into the homes of persons who are already being treated for illness and they're not able to be mobile, because I know many of our elderlies are living alone. We are not socialized to have a multi-generational homes anymore. So you find that persons are leaving home and leaving their elderlies on their own. So we need to address that. They're not forgotten. They still have value, and we need to take care of them. So the shuttle, the mobile system, having specialized nurses, having proper management, making sure that we have specialists at the hospitals, especially in Roxborough. And I understand to an extent that there might be merit whereby not allowing certain surgeries to occur at Roxborough. We have to take into consideration if you do not have the right facility, the right doctors, and for aftercare, you run the risk of medically being, for negligence. You have to be open. You have to have insurance. So I'm hoping that in the future that Roxborough will be able to have surgeries that we don't have to travel all the way to Scarborough, because I suffer from migraine, and sometimes even I might be teaching and I don't really get the time to eat, and that would go on. And I remember once gotten real ill, and I had to take the service, I think the ambulance service, to get down to Scarborough, and honestly I felt worse going down because the curves, nausea. I was like praying. I was like, you know what? I wonder if they could just let me out and I'll ask somebody to pick me up, because I could not manage, and it took an hour because they had to be driving
Rosemary,
properly.
sorry to interrupt you, but we're trying to get to other people. If you're almost
so thank
through.
you. And yeah, that's it. I will allow for someone else.
Thank you so much. Because part of our objective is public awareness, could Dr. Major tell us where the medical mental health care services are, what centers?
So currently, mental health services can be accessed at the Scarborough General Hospital, the Roxborough Hospital and Health Center, Mason Hall Health Center, and the Scarborough Health Center. Clinics at the Scarborough Health Center are every Wednesday, but they also have our counselors as well as the psychologists and psychiatrists for clinics during the week as well at the Scarborough Health Center.
Thank you. Lady in blue, go ahead, please.
Maria McFarlane. I am here with the CDAP, Society for Responsible Persons Over 55. Okay. I know that the budget is a finite budget for health in the country, a finite budget for Tobago. Is a question of where do we lay emphasis. And I find since 1997, when they had a change of operation of the management of health, at that stage, there was an accent and a push towards primary health care. And funding was extensive. Lots of new departments started, and a lot of new jobs were created for primary health care. And it is up to today. But we are suffering from tertiary health care. Specialist people, especially in Tobago. You know, there's a thought that goes like this. We can't have a specialist for this and a specialist for that and a specialist for the other in Tobago because we are a small community and we wouldn't have enough work for these specialist people to do. That's a thought, okay? But so they tend to go with that and what I would call the low-hanging fruits, primary health care. But primary health care information that you could get, just pick up your cell phone. And they tell you all about diet and exercise and what you're supposed to eat. They even have this new thing about keto diet, which is conflicting towards the conventional diet because now they're saying eat fat, you know, and you wouldn't get no heart attack because before we was taking up, we was doing the Mediterranean diet and we were still getting heart attacks and clogged arteries. So it's all confusing. Nevertheless, I know that the accent is towards primary health care still and at the expense of tertiary health care. So what goes on in Tobago is that those who are in the secondary health care write a lot of referrals. Referral to Port of Spain General Hospital, ambulance, helicopter, and so. They do just writing because they are no time to really go and do no big surgery, you know. So just send them all out to the specialists in Trinidad. And because of that now, you find the government always complaining about the high helicopter bill that we have. I find, you know, we should take that money that we're spending on helicopter bills and get specialist people here instead of, we're getting specialist people in, but they come on a Friday evening, they come on a Friday morning, and they go in the sea Saturday, Sunday, and then they fly back. Or sometime, you know, in the middle of the thing, they say that they have to go because the plane is 3 o'clock. And we don't, the only way we will get a specialist person to be serious and bogged down and do the work is if there's a permanent job for them. They stay here, we pay them, and they do the work. When time to do a critical surgery, there's an accident, bones broken, they can go in, stop bleeding, and mend back bones. This is the kind of specialist people that I would like to see have permanent jobs in Tobago so that we don't have to be helicoptering everybody out. And another area that we need to really have specialists in is in that radiology department. You can't get an ultrasound or MRI on time because the thing have to go to Trinidad to read. And I know that it takes seconds by email, but in that radiology department, it takes months and months to get a report read. I remember when my husband, he passed, but before he passed, he was in oncology. But when Dr. Ramesh came over, Dr. Ramesh couldn't deal with him because he couldn't get the ultrasound report. And I go to the ultrasound report over and over, and all they're saying is that it not come back yet. It not come back when, how soon, we don't know. It just not come back yet. And there. And it's months before his treatment could be started. You know? I'm not saying that he wouldn't eventually die, but you know, everybody does want to live, not die, and he could have a better fighting chance if we had an earlier report on the ultrasound. And sometimes a MRI is needed. We don't have that. And the critical care testing, we don't have it in Tobago. And I don't find I find, you know, we need to lay a greater emphasis on critical tertiary level care. Perhaps in 1997, when everybody didn't have a smartphone, it was important to weigh in heavily on primary health care, but everybody know how all about primary health care, how it is important. I mean, the man in the streets will come and tell you how exercise and diet and what to eat and what. We don't need to spend all this money on primary health care in this day and age. We need to spend it on tertiary level care. Get the specialists in. Give them a permanent job so they can't duck and weave and hide. They have to stand up and do their work properly. That is what we need. Thank you.
Thank you so much. I'll allow Member Monroe to introduce the next topic, and one, because we're running short on time, and then Member Singh right after can introduce the other topics so that we can fast track this interface.
Thank you very much, Chairman, and good evening again. Next topic, health and wellness for men. So to the gentlemen in the room, we want to hear some feedback for you. This committee recently heard that men usually shy away from healthcare facilities. I would like to know, do men need to be specifically encouraged to improve their propensity for accessing the healthcare system? And also, I want to know from you all as well, what do you suggest that the government do to improve its strategies for men to seek early screening and treatment for NCDs?
The floor is open. The floor is open. The gentleman in the back, put up your hand. You had your hand up? Yes, sir. Because one of the things we have encountered in our, you can go to the microphone, sir, in our 4 previous public consultations is that men tend, and this is a global phenomenon, not to seek medical attention for several different reasons. Go ahead, sir.
Pleasant afternoon to members of the head table, members of the audience. My name is Iyuzi Adinbi, Iyuzi Akenitin Bologan Adinbi. I'm here to say a few things concerning general health care. I would like to continue from where the lady had left off here. Concerning proper facilitation or healthcare facilities at the hospitals and health centers in the rural areas of Tobago. You see, the health centers at rural areas should be equipped with theaters to deal with critical situations. So, patients could go there and be treated, and maybe when they are in a stable condition, you transfer them to the hospitals. This is very, very important. And nextly, I would like to switch to sanitation, because we are dealing with public health care. I would like the sanitary inspectors to have some clout, that if they visit my home and see certain things that are not supposed to be, they must give me a warning. And if they come again, they must be able to take drastic actions. But the sanitary inspectors just go begging people, and they don't have certain authority. So I would like these people to have some weight behind them. Because there are many homes where people have a cesspit system, cesspit tank, yes. They have no soakaway. And that water runs straight out into the drains. That must stop. This is a very, very, very serious issue we have in Tobago here. No, it's a very, very, very serious issue, and I like something to be done about that. Then for doctors that may malpractice and endanger the lives of patients, I think I would like to see a group of trained doctors who must be lawyers also. So when these things happen, that particular group must do the investigation. And if I'm a doctor and I cause the life of a patient, it mustn't have any like. All of us are members of the medical, so it will have a little cover up here and there. No. They must come out and say, Dr. Dinby, because of X, Y, Z, 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 the patient died. And you have to stand the consequences. So I don't know if you all could put something in place for such. I mean, it's a serious issue. And then, I don't know if Trinidad and Tobago have a bureau of standard or a bureau without standard. Why I'm saying this? If you buy the LLB in the can and certain other things, certain other canned stuff that members of the public have to consume, when you open the can, the exterior end up in the can, in the contents. That is unsanitary.
Okay, I'm going to...
How you all have these cans?
I am going to interject. That is not the remit of this committee. I understand it may be a health concern.
Yes, it's
but
a
that
health
is not
concern.
but it's not
Right?
what we're here to deal with.
Okay, well, sir,
All right.
I don't know. All right. Because remember, you said healthcare. And I'm going, that is just, let me switch. Healthcare. What about the supermarkets where you have all these seed oils and these things like corn oil, soybean oils, and anything that is a hydrogenated vegetable, whatever.
Okay, again, I'm loath to interrupt you, but we're not here to deal with that aspect of healthcare.
All right.
And health
So,
and wellness
you're not
maintenance.
there to deal with
No,
that
that's-
aspect of healthcare.
We're here to deal with the
Okay.
NCDs and your interface
the NCDs
with the
and
public
the
healthcare system.
Okay, I'm very
All right?
sorry.
That's all right.
I thought, well, you all were dealing with healthcare in general.
Not that widely.
All right, sir. Well, I would give somebody else an opportunity to make their contributions, okay?
Thank you very much for your
Yeah,
intervention.
respect.
Let me just let Member Singh introduce the next topic so that we can fast track.
Thank you, Mr. Chairman. Mr. Chairman, the next topic, I think some persons have already commented, but I'll just throw it out again. So we want to hear from you, your experiences in terms of access to medication. Have you had challenges accessing prescription drugs at pharmacies and public health institutions? Do you face challenges with accessing prescription drugs and any pharmaceuticals, the CDAP drugs that is? We would like you all to share some of these experiences with respect to that.
And Member Monroe.
Thank you, Chairman. I will just like to touch on patient records management. Question: have you encountered a challenge with the misplacement of your medical records by a public health institution? And if so, what was the outcome? And the following question is, have you ever had a request of your medical records from a public health institution to provide a private healthcare institution? And did you encounter any challenges? So from the public, you requested it to take it to the private, and did you encounter any challenges?
So we're opening the floor to access to medication and your patient record management system. And of course, still, if gentlemen want to, and if you've contributed before, you can come again and give us your experiences. It's not limited to one interjection. Can someone take a microphone to the lady in the blue, please? Thank you.
Thank you. I did not say in the first time when I stood up I was representing really the Blind Welfare Association. I came on, you know, I was invited to come by that entity. I just want to say this. In 1978, Trinidad and Tobago was a signatory to a Geneva Convention, the Alma Ata Convention. It stated that healthcare must be affordable. It must be accessible. It must be acceptable, available, and safe. And if we as a country, we adhere to those five, the 4 A's and the 1 S, I think we might have been in a better position as far as healthcare is concerned. 3 years ago, my brother, he's now deceased, he went to the hospital. Roxburgh was not there as yet. And he was scheduled to have an MRI done. And every week he goes, the machine is down. So the wife got, the wife got angry. She said, you know what, I'm taking my husband to Trinidad. They said, no, you don't have to. The machine is going to be fixed soon, and next month. So she waited. I had conversation with her. I said, girl, carry your husband to Trinidad. So she was only able to get the MRI done in San Fernando. We paid the money, and she had it done. 1 year after he passed, Scarborough Hospital called. Is this so-and-so? And the wife answered yes. Well, we want him to come up to the hospital next week to have his MRI done. She said, well, okay, you can go to the Plymouth Cemetery and give him that information. It pains me as a former healthcare worker to know when we were at the old hospital, listen, we had no specialists there. We had Mr. Delpert, who is now deceased. He used to give diagnosis by just examining and stuff like that. Now we have every digital thing to assist, and yet there's misdiagnosis, no diagnosis, nothing. You go, I personally went to the ER in the Scarborough Hospital there now. I went on the 3rd of June in 2019. The 3rd of June at 12 p.m., a doctor from St. Vincent, she was here doing her internship and she saw me. She said, you know what? I want you to come back on Friday. That was the Tuesday I went, on Friday of the said week. When I got back to the ER, well, I told the lady, the nurse, and she said, well, let me see if I find your notes. I said, well, I was only here Tuesday, so the notes should not be far. And they searched, and they searched, and they searched, and could not find my notes. Ridiculous. I took my elderly mother to have some blood works done, and after 2 weeks, no report, because you had to have the blood work when you're going to the clinic, and they could not find the report. And I think the level of negligence that is being exercised at that hospital needs to be addressed. Yes, Tobago is small, and Tobago has a few people, but we can also enjoy the benefits of having a specialist doctor in various fields resident here in Tobago. And let me say why. Because, the doctors here in Tobago, and I know I'm correct, they are being paid more than their counterparts in Trinidad. And therefore it is unfair for the Trinidad doctors to be helping the Tobago doctors to do their work, because the helicopter fee is not here. It's a high cost. It is about time that we hire competent doctors who will do their work diligently, because based on the oath of office.
Can I interject and just ask a quick question, and
Yeah.
ask for a very quick response because we're running out of time?
Yeah.
You're a person with a disability.
Yes.
Do you find that there are challenges or are there accommodations made for persons with disabilities?
Not-
And I really want a quick answer, if you
No.
could.
The answer is no. And I did not raise it here because I wanted to deal with the directors of blind welfare first, you know, to lay out my complaints to them, because we are supposed to have a meeting. The answer is emphatically no.
Thank you very much. Thank you for your contribution. In our next few moments, we're going to open the floor generally to persons who want to, even if you've contributed before, to make a few comments, closing comments, things that we may have missed that you think we should know in terms of your feedback to include in our report to present to the RHAs and the medical healthcare administrators. Is there anyone who would like to make a quick interjection? Yes, two people there. And if we could keep it concise, and then the lady, and we will wrap up after that. The lady who had a hand up there? Yes, yes, ma'am. Yes. Can you go to the microphone? Would you like it brought to you? Thank you. And again, if you could keep it concise.
Good evening, everyone.
Good evening.
To the committee. My name is Lennon Grant Andrews, and today I represent Baby Loss Solace Seekers. It is a peer support group in Tobago that facilitates support for mothers and fathers who would have lost babies. I have with me Khadijah, and some of our other members are viewing online. It is a difficult topic that we usually have to discuss, and many of the topics that have been addressed here today touch and concern us as well. And so I would just like to make a few comments about what our experiences have been, and it may not just be my personal experience, but what we have experienced. So a comment, one of the questions, I think it was by Member Monroe, concerning men and getting access to public services, etc. And I will answer it by saying that we noticed too that in our grouping, we hardly have the fathers being as involved in baby loss and speaking about the topic. Not to mention, they would not usually get like leave, should paternity leave, that those issues are not generally addressed for them. On the whole, we do note that baby loss does affect most persons mentally as well, and so for us, mental health is a very strong issue that we find, or we are generally challenged to find resources for. So for instance, I would say that there are issues in the system. I would big up our doctors, our nurses, our medical staff. Things do go wrong from time to time. And also, too, sometimes babies just die. It's no one's fault, they just die. However, we do believe that there can be more sensitive training for our medical team. My personal experience and the experience of some of our other members is that many persons don't know what a miscarriage is like or what it is. You go into labor in the usual way like any other mother having a live baby. The difference is for many of us, when we speak about our experience, is that we will say, me too, it happened to me too. You are left by yourself in a room to wait for the baby to come. And it is a very lonely experience. Not to mention the painful, physical, painful part of it. It is also emotionally painful. And that seems to be a trend that we notice generally, that that part of our care is not addressed. And many times, you just get it flippant, well, they know the baby will die, so, nobody has any time for you. So I just wanted to make note of that. We do offer support services to persons generally, but we notice that it is, while counseling should be available and is available, there will be persons, mothers, who will tell you, no one offered me counseling, which means that it is available. Some of us afforded it or offered it, or it's suggested to us, while some are not offered it, which says that there is something wrong with the system. The policy is not continuous, or it's not applied across the board. So my recommendation, or our recommendation, would be that there be a policy in place where mothers and fathers, if they lose a baby, that the care is the same throughout. Even a simple, well, you may say it's simple, but my experience was that when I lost my son, the doctor told me, no, a nurse told me, make sure they give you this medication to stop the milk from coming. And I would hear other mothers say that nobody ever did that for them, and so they had that uncomfortable, painful experience of having to have the milk come in and no baby to feed. So for me, that would also be a critical issue to address. I would say, though, that my experience besides that is that I continue to have confidence in our medical team. Not everyone is perfect, but I do believe that the doctors do work very hard. I am also mindful that in the hospital, these doctors, they work more than most persons work. They work round the clock. And another comment I could make with respect to just generally in terms of diabetes, etc., is that the medical team will suggest to the patient, you need to take this medication, don't eat salt or don't eat sugar, etc. But people do what they want to do. As you'd be like, you don't have high blood pressure, I gotta just take the tablets. Harvest coming up, they're eating what they want. Christmas coming up, and so we have all these different time periods in our daily lives where we know that you will expect patients coming in because they're not managing their medical life properly. And so while the doctors can do what they can do, at the end of the day, each person has to take accountability for self. So there's more that we could say, but thank you.
Thank you so much. And please feel free to send any other comments that you may have and your group may have to the Parliament's website that we may include in the report. Thank you for sharing that. The lady with the pink, is it? Somebody, you? Yes?
I wanted to just first express gratitude for the opportunity to even express these things. I come here as an individual, but I am a member of both TARP and the Yahweh Foundation, but I don't represent them. I just wanted to share in response to your purpose, our experience with the healthcare system. My first encounter with the
Could you just come a little closer to the microphone, please?
Pardon?
Could you come a little closer to the microphone, please?
You're hearing it better now? Oh, sorry. So my first experience with this healthcare system was amazing. I broke my nose very shortly after I retired and came to live here. And everyone in my family was horrified and scared and concerned that I would receive adequate care. And my husband and I came to A&E. We were taken care of within a very short time. I found all the staff very competent. I was very comfortable, and everything was resolved well. That was my first experience. I just want to speak to the positive mostly because I find in that 80-20 thing that a lot of people have experiences that may not be so good, but I think to concentrate on the 20% that was a problem is not very helpful. So there are issues, but I'd rather emphasize the positive. Having been born and raised in the United States, the first thing, I think someone else said it, the young lady from the Army, free health care is such a blessing. It's not just the cost, but the psychic effect on your mind that your health is considered a right of citizenship, which it is not in the United States or many other places, and that has a lot to do with stress and illness and all that comes with it. So I just really want to emphasize the fact that when you have free health care, that is such a blessing that should be appreciated. And it comes at a cost, and there will be costs. So some of the things that I've heard, that comes with the territory, the delays or whatever. So I just wanted to bring that up. Another amazing thing that I've experienced here is through my husband's experience with the healthcare system. The cataract backlog program was an incredible example of coordination and operations and just compassionate care that I found to be tremendous. And I don't hear enough acknowledgement of that. And it really is an amazing thing. I mean, just the logistics of putting that together internationally and with all the people who were involved in it, I just can't say enough about it. Some of the few less positive things that we experienced were in access to care, and that was because we found that when you go to the Scarborough General and you have to sit in A&E, we had experiences with delayed responses to our medical needs that did, unfortunately, I feel, result in amputations that I think would probably not have been necessary had they been dealt with sooner. And that is just also to address, I know you all are concerned about NCDs. This involved diabetes, and so there are certain things that to me are obvious. For instance, the very first time we went to the hospital, and even though the doctor had recommended, I saw his referral, that there be debridement and different things, they didn't even examine the wound for 4 days, by which time an amputation of a digit was necessary. But again, that was couched with the fact that the care that we received from the doctors and the staff was quite good. So, unfortunate consequence. And that happened again a few years later, something similar, where I believe access to the care would not have resulted in those amputations. I also share the concern somebody expressed about amputations on this island, and we know diabetes is a problem, but I just can't understand why that's the solution. I'm not a medical professional, but I just feel like there have got to be other ways to address it. And then I just wanted to close with some suggestions and solutions. I do feel that the collaborations like the Cataract Backlogs program are making use of partners and other organizations. When your resources are limited, the more you can cast your net out there, you have more. And there are organizations also throughout the diaspora, I'm learning, who are very interested and committed in working with Tobago to provide awareness, particularly around diabetes and hypertension and these lifestyle diseases that we seem to be plagued with. But I also, two other suggestions. It is free, but I think limited and perhaps sliding scale co-payments for certain things like prescriptions or specialist care or certain kinds of diagnostic tests. I don't think that would be too much, and I know that everybody has limited means, but to make it more affordable, because a lot of the things that I've observed are just due to the limitations of the regional health authorities in terms of their budget, and certainly Tobago, which has never gotten the allocations it really needs for so many things, they just don't have the money. So I think that a reasonable look at what could be co-pays going forward, I don't know if that's in your remit, but I think that would be a lot better than having non-working machines or some of the things that have been the result of the budgetary problems. And then lastly is just a pet peeve of mine. I used to be, one of my fields was human resources, and I just think cell phone usage during the business day, especially in a medical institution, should not be allowed. That's like, to me, basic HR policy. You should not be allowed to sit on your cell phone when you're on the job. And unless your actual work requires that, which I can't imagine that it would require your personal cell phone, I just think there are certain easy policies that should be introduced, because it's very disheartening to have a medical emergency or any kind of situation, and you walk into a hospital, even a healthcare center here, and everybody's on their phone, or they're looking at their phone, and they may look up to take care of you, and they may even be responsive, but I just don't think that should be allowed. That's just my personal, it's just, doesn't allow people to focus on their jobs, and it's certainly not contributing to their productivity. So,
thank you. We take a final intervention. Can we take this lady here because she hasn't gone, and we have a very, very short timeline. So if we could ask you to keep it as concise as possible, please.
I most certainly will. My name is Inez Ayers, and to the panel, to the audience, and the young lady who spoke about from the U.S. and the health care here. My family was here this past week, and they got to experience this beautiful, beautiful island. Even your health care system. We had to go to the hospital at Scarborough. We were treated quite well. Yes, they had to wait, but you have to wait everywhere you go. I'm also a travel advisor. I won't book my clients without getting travel insurance anymore, particularly since COVID. So please stop. Stop this stream of income that you can have. I don't understand. People come with travel insurance, they show it to your staff, and they're like, no, you need the money, we can use the money to buy machines. They expect to pay. They have travel insurance. Bill them something, if it's $5 US, whatever. But they need to stop. That's just money going down the drain and going back with them. They can apply for the insurance when they get back. So that's my recommendation, is to please start utilizing people for the visitors that come. No, they have to pay. Thank you.
Thank you. And we'd like to thank you all for your contributions. I think we have one more person. Again, I'm begging you to keep it very short because we're running short on time.
Okay. When I was here at first, I did not say that I'm representing the Canaan Bonaccord Diabetes Association. Okay, the question was asked before if I was ever referred to at the house, go to the public service and told that I had to go to do it privately because the machine was down. Yes, I had that experience, and when I went to the private place, the person who told me that the machine was down and the part had to go to Miami to fix was the same person who dealt with me.
Thank you. I'd like to thank you all for your contributions. We really appreciate it. You're sharing your experiences, in some cases very painful experiences, and also those who shared positive experiences. As we close, I'd like to invite Dr. Ogona Okiki, Medical Chief of Staff at the Scarborough General Hospital, to make a few comments, if you would, if you care to.
Yeah, good evening, everyone, and thanks for your comments and criticisms. As you all know, no system is perfect, but if you look at the statistics, you would see that a majority of people who access our healthcare system and are satisfied are of a very much higher value than those that may have some dissatisfaction. This is our own healthcare. We could criticize it all we want, but at the end of the day, it's our own. So that we take the criticism, but I know all the doctors, at least at the level of the Scarborough General Hospital, those who've worked with me over the years, and I've been here for some time. Right now, in fact, while I'm sitting here, there are doctors who are having challenges with certain issues going on in the hospital, and they're here 24/7. Sometimes they go to bed and come back within a few hours. And just because of dedication, they stay on at work. So at least from time to time, encourage them. They may look tired, they may look cranky, but I say that they have the best interests of the public at heart, because at the end of the day, we all one big family here. Not to say we have it 100%, but I think that the reports we get, nobody ever talks about the good news. We get emails, we get comments, we get from all walks of, whether it's from the attendant who treated them nicely when they were leaving, whether it was in the radiology section, even surgeries that are done, complex surgeries that are done here. There's a whole lot more satisfaction, but that is life. People do not come forward to say that things are good. Most people don't, but it's the bad. So let nobody leave here and think that Scarborough General is a bad place to be, because if you go right now, you're going to see people there, and a lot of them are getting satisfied, good satisfaction. All I can say is that criticism and comments, we've listened to them all. We'll continue working on it as best as we can with the resources we have, and just continue having faith in Scarborough General Hospital, and indeed, by extension, the TRHA, which we fall under. Thank you.
Thank you very much, Dr. Okeke, Medical Chief of Staff at the Scarborough General Hospital, and Mr. Garth Alexander, Chief Executive Officer at the Tobago Regional Health Authority. Mr. Alexander.
Greetings and good evening to everyone. Let me first recognize my Deputy Chairman who's in the audience today, Ms. Danik Jerry. Thank you for joining us here today, as well as the staff, some other staff members of the TRHA, particularly our administrator, hospital administrator for the Roxborough Hospital. Your complimentaries for the Roxborough Hospital are well taken, and we'll continue to try to maintain that standard of service to you. Now, if there is one thing that I have taken out of this entire session, and I would have been putting it up in my Teams channel for the communications team, is that we need to sell ourselves better. We are doing so much good work, and it is not being recognized, because I paid attention to a lot of the comments, and the comments are misrepresented, not purposefully so, and I could understand why. Because if the public does not know, it comes to us to inform them. So it is something that you may see from us a little bit more. Our medical imaging services, we accept that there were problems with that. We have done a lot of work in that area to bring these equipment operational. Our MRI is operational again. So what you will see is a lot less people being transferred to Trinidad for that service. That perspective of people always jumping on a plane and etc. to go to Trinidad for services, again, we check the numbers, and that has decreased significantly during the course of this year, because we have made the effort to improve those services, as well as to make sure that the equipment to support us are functional in Tobago. We are on a drive to upgrade equipment as well. We are improving our staff with respect to training and development. The HR issues are well noted as well. So we understand where we were. The TRHA accepts responsibility for where it was at that point in time. But we have done significant work supported by our line secretary, Dr. Faith B. Israel, and the board. We have some strong mandates because we understand your complaints. So therefore, as I would say, we have to do a better job to get that information out to you. Even with respect to the reporting of the radiology reports, we are currently on a drive to decrease that backlog. So those of us who have not received the reports, I suggest that you come in, get that information, and we'll be directed accordingly, be it at Roxborough, at Scarborough, or at the health center. We have done a lot of work. Probably we are not giving ourselves enough credit. It is not a matter of even accepting credit or getting public adulation, but we need to let you all know what it is we are doing. So I have taken that note. I have made that suggestion to my team while we were sitting down here, and we'll have that discussion in terms of letting the public know what the TRHA has done, what we are capable of doing, and how we plan to move forward in the future. And with respect to, in terms of, my apologies, once the secretary gives me the go-ahead, you'll be hearing a lot more from us. So thank you for your comments tonight, and have a good evening.
Thank you. And Dr. Roxanne Mitchell. Closing comments?
Thank you, sir. I would just like to make the public aware that we are here to deliver services to the public of Tobago. We may have some shortfalls, but I'm encouraging you, please, to come in. If you do have those shortfalls, Mr. Anderson, all right, and we will try as much as possible to make the system a lot more accessible. We are also trying, as Mr. Alexander said, to build out a lot of our services and make certain that they are available. We are doing a lot of work. We do have ultrasound within primary care. We have mental health services within primary care. A lot of these services are now more accessible outside of the hospital system. You can access primary care services, the walk-in services for urgent care at Scarborough, Mariah, and Canaan Health Centers, and of course the emergency departments at Scarborough General Hospital and at Roxborough Hospital. We are here to assist. If you have concerns and you think that you are being led along just a little too long, you have the quality department, you have the CSRs that you can come to us and have a little chat, have a discussion, and we will try as best as possible to make certain that we try to shorten that gap and to relieve any of your fears going forward. Thank you.
Thank you so much, Dr. Mitchell. We'd also like to acknowledge and thank for their presence, Dr. Faith B. Israel, Secretary for Health and Wellness, and Deputy Chief Secretary. Thank you for being here. We appreciate your presence. We'd also like to thank Senator Dr. Maria Dillon Remy and Senator Hislop, who was here earlier on. We'd also like to thank the following groups for participating and being here: the Tobago Regional Health Authority, the Trinidad Tobago Association of Retired Persons, the Yahweh Foundation, the Roxborough Police Youth Club, and the Trinidad Tobago Red Cross Society. We would like to thank for their contribution the Office of the Chief Administrator, Tobago House of Assembly, the Division of Health, Wellness and Social Protection, the Division of Food Security, Natural Resources, the Environment and Sustainable Development, the Tobago Regional Health Authority, the Clerk of the Assembly Legislature and her team, the management team of the Scarborough Library Facility who hosted us today, New Lens Productions, and all who provided assistance and support, and to the viewing and listening audience, and to the members of this committee, both present and in absentia. This concludes the committee's fifth and final town hall meeting on the issue of public healthcare services in Trinidad and Tobago. On behalf of the committee, I would like to wish you all a good night and thank those of you who attended here and those who viewed and listened on the radio, and wish you all a good night and a safe passage home. Thank you very much.